Well, what you need to do is like anything we do in medicine, you need to make a diagnosis with the neck lift. So with a neck lift, it's obviously more than what just the fatty layer is. Whereas the liposuction was really just dealing with the fatty layer and asking the skin to contract. Doing a neck lift is dealing with the skin, the fatty layer, the platysma muscle, and any drooping or band we call platysmal bands. Those vertical lines that I was referring to, often called turkey gobbler bands or chicken neck or whatever. And we see them very frequently in the over 50 and certainly over 60 crowd. Now, if somebody has a heavy neck, they may be underneath that. And so taking away the fat, sometimes you unmask those because they're often there in their 60s and 70s. And then again, the deeper structures I was referring to below the muscle, there may be some deeper fat that's giving some of the fullness, and there's also glands and other structures that can drop down, and so contouring those may be necessary as well in order to get the best looking neck. And so you want to discuss all of those things with your potential patient. Whereas I would say most neck lifts would probably take about an hour and a half to do versus say a half an hour for the liposuction alone. And of course with the neck lift, we're usually tightening up the skin. So typically, in most cases that I do, the neck lift would involve an incision that sort of starts around the earlobe, comes up in the crease behind the ear, back and along the edge of the hairline and back and behind the hair. And of course, same sort of thing on both sides. As well, in most cases, an incision just below the chin crease in here. And that allows access to what we call the midline structures in here. So in order to access all of these things, we sort of come underneath the skin, leave the amount of fat you want in the neck attached to the skin, and the fat you want to take is still the deeper fat on top of the muscle. So that often is if it hasn't been liposuction before, then we'll suction it out. And in some patients, they've never had liposuction, but they still have a very thin neck naturally, even though it's an older neck. So in some cases, we certainly don't take fat out if they don't need to have fat out. So then I will often contour the muscle, often tightening it. We say the two muscles that sort of run up, one on each side. We'll tighten the midline here, and then we'll bring it up this way and create a sling effect underneath here. And again, prior to tightening it, if we still have to deal with the deeper structures yet, then in the midline between the muscles, we go underneath that and expose the other little muscles in the neck or the glands or things that may need to be contoured to give the best shape and look.